What if your muscles could help you to survive a severe illness? That sounds like a fitness slogan, but in critical care medicine, there is real science behind that data. When most people think about muscle, they think about strength, performance, or appearance. But in medicine, muscle is much more than that. Muscle is a metabolic reserve. It stores amino acids. It supports whole body metabolism. And during major stress, that reserve can matter. This becomes especially important in critical illness because patients in the ICU often lose muscle mass very quickly, not over months, sometimes within days. And this is not a rare problem. A recent systematic review and meta-analysis found that low skeletal muscle mass is present in about 51% of critically ill patients. So roughly every second ICU patient may already have low muscle mass. Now here's the key number. The same meta-analysis found that critically ill patients with low skeletal muscle mass had an approximately 2.4-fold higher mortality risk than those without it. Of course, that is not proof that muscle alone determines survival. However, it does strongly suggest that muscle reserve is clinically relevant. So the signal is consistent. Low muscle mass is common and low muscle mass is linked to worse survival. But survival is only part of the story. The other big issue is recovery, because many patients who survive critical illness do not bounce back quickly. They often leave the ICU weaker, slower and less functional than before. A major complication is called the ICU-acquired weakness. It affects about 4 out of 10 critically ill patients, and this weakness matters. In one follow-up study, ICU-acquired weakness was associated with a 3.6-fold higher risk of death after ICU discharge. And 6 months later, patients with ICU-acquired weakness had clearly worse physical functioning than those without it. In that study, the median physical function score was 45 versus 75, which is a substantial difference. Another important study showed that 1-year mortality was 30.6 in weak ICU patients compared with 70.2% in matched patients without weakness. So when we talk about muscle in critical illness, we're not just talking about whether a patient survives the ICU. We are also talking about what life looks like afterward. Can we walk well? Can we return to daily life? Can we regain independence? Now let's be careful here. This does not mean that being muscular makes you invincible. And it does not mean that going to the gym guarantees survival if severe illness strikes. That would be, of course, nonsense. But it is scientifically fair to say if critical illness happens, people do not start from the same baseline. Someone with more muscle and better physical reserve may simply have more physiological room to lose before reaching a dangerous threshold. That is why I would frame muscle as resilience tissue, not just performance tissue. So the obvious question then is, can we do something about it? And at least to some extent, yes. One important strategy is early rehabilitation. A meta-analysis found that patients who received early rehabilitation were less likely to develop ICU-acquired weakness than patients receiving usual care. More specifically, the odds of developing ICU-acquired weakness were reduced by about 37% in the screened population. In simple terms, starting rehabilitation early seems to reduce the risk of becoming profoundly weak during critical illness. That does not mean every intervention has a huge effect. And it does not mean that the field is already settled. There is still debate about the optimal protein dosage. There is still debate about the best rehabilitation protocol. And there is still an important question of causality. How much of the survival signal comes directly from muscle and how much reflects overall illness severity? But the broad picture is clear. Low muscle mass is common in critical illness. It is associated with markedly worse survival. And muscle weakness after critical illness predicts poorer recovery and higher long-term mortality. So what is the message for healthy people? It is not fear. It is preparation. Train, stay active, build muscle. Not because it makes you immortal, not because it guarantees survival, but because it may give your body more reserve when life becomes physiologically extreme. Your muscles are not only for movement, they are not only for sport, and they are not only for aesthetics. They are part of your reserve. They are part of your recovery potential. And they may be part of your resilience when severe illness hits. So here's the final takeaway. Train your muscles before you need them. Because one day your body may need that reserve for something much more important than performance.